I'm Dr. Brian Nickel, your cannabis expert for CannabisExpertMD.com in Hot Springs, Arkansas today at Green Springs Medical, speaking with Dragan. Dragan, great to be out here with you today.
Hey Brian, how's it going? I'm Dragan Vicentic with Green Springs Medical. We were the first dispensary in the state to open, and we've been at it for about 4 years now. And just about every day somebody comes up and they say, hey, thank you for doing this. And at first, I thought, okay, well, I'm just bringing medical marijuana, but it's actually much more than that, Brian. People are thanking me because they're getting their life back. They're getting off of opioids. They're getting off of all of those harmful prescriptions and changing it out with some natural product, and that's medical marijuana. And they thank me every day. They're like, you gave me my life back. I can actually play with my grandkids now, and I was a zombie before.
Well, one of the best things I always tell patients about medical cannabis is the dirty little secret about cannabis is you go into a dispensary, no matter what you walk out with, you're going to feel somewhat better. Getting from a little bit of improvement in your symptoms into a real big improvement in the quality of your life while minimizing side effects, that's where the knowledge comes in, doesn't it, Dragan?
Absolutely.
And one of the things I've always appreciated from the day you opened is that you're one of the few dispensary owners that I've met that has actually educated themselves about medical cannabis. Do you find your approach as far as giving information to patients that they can use to utilize medical cannabis more beneficially? Not does it just benefit the patients, of course, but has it benefited you as a business owner?
Absolutely. My knowledge of medical marijuana has grown so much, and teaching people has become a large part of that also. And by teaching people, when they come in, 9 out of 10 people, they have no idea what they want, what they need, how it works for them. So we love to educate people every single day. And the main thing is you don't have to smoke it. You can smoke it. You can vape it, which is a lot healthier, or you can do edibles. And the beauty of edibles is they'll last 6 or 7 hours versus inhalation. So all of these aspects you need to explain to people whenever you're consulting with them. But more importantly is they have to find that strain that really, really works with their body. And so many of these dispensaries that are prepackaged, you don't have that option. And what I mean by that is when they come into Green Springs, we have a deli approach, and we have everything in mason jars. So you can actually open the jar, the patient's right there in front of you, and let's say they want a sativa, we'll lay out 5 or 6 different ones, and we'll actually have them take a whiff of them and see what they think about it. Because the 5 that they smell, the one that smells the best to them are the cannabinoids and the terpenes that their body is actually looking for to help them heal. And when they go through that step of finding that strain that's going to work the best for them, they're so much ahead of the curve of any prescription that anybody can give them.
And it is the terpenes you're smelling when you open up the top of those jars. And it's interesting. I like the idea that your body knows what it needs to help it. As they get more experience with it, they're going to start recognizing particular scents that they know work for them. So I do like that particular approach. It probably is a lot more inconvenient as a business owner to provide the deli style and have the patients be able to smell it. But again, you extend that service to your patients so that they can take better care of themselves, right?
Absolutely. And we do it every day.
Now, Dragan, I know you've started growing cannabis in-house here. What are you guys growing these days?
So we've got about 10 or 12 strains. We're into our 3rd harvest. Alien is our last one, and Nutter Butter. So we just kind of have a little bit of a variety that the other dispensaries don't have. And that's kind of what you do, because if it's something that everybody else in the state has, it's not new, or it's not maybe a medicine that you haven't tried and that might work for you better than some of the other ones.
Now, are you guys using your cultivation grow as flower for patients, or do you do secondary processing to the ancillaries such as vape cartridges or concentrates?
So before we actually started growing the flower, we did some processing. We would take the flower that we purchased from other cultivators, and we were actually the first to have suppositories in the state, and they work really well simply because a smaller dose with that type of application goes so much farther because it doesn't have the filters that you have when you take an edible. And then also we've found that using suppositories, they'll last anywhere from 10 to 12 hours.
especially when trying to get the localized effects in vaginal or rectal tissue. I've noticed it's very useful for that.
Yeah, your whole center area is just super medicated, and it's a wonderful feeling. But other than the suppositories, we've done tinctures. We also have Move with Ease, that is an ointment that's CBD and THC that works very well, and RSO. We've had that, and then fast forward to about 6 months ago, we started actually growing. And we've done mostly flower with it. We do some white label vape carts and some more RSO that we have others process for us. But we're super excited about it because we bring different strains that other places don't have.
Are you using any particular process, or are you using multiple ones throughout the state?
So Dark Horse first approached us, so we've been using them the most. We have talked to Leafology, and they've got some amazing equipment that they've got in. It's just kind of does everything for them, and there's just not very much room for any error, which we like a lot. So we might take a look and see what they have to help us with some processing in the future.
So what do the patients of Arkansas have to look forward to the future from Green Springs Medical?
So the future, of course, recreational is always on the table. I just hope that the next time that we, try to get recreational on the ballot, that it kind of helps everybody, so that everybody will vote for it. But most importantly, is I think that in the advertising we should educate people that haven't used cannabis on what it could do for them. For instance, you could tell them that it helps you with blood pressure levels, it helps you with anxiety, helps you sleep, pain relief, of course. I mean, that's kind of a misnomer. Everybody knows that. Reduces your sugar levels. I mean, there's just a ton of things that medical marijuana helps you with that people are not aware of.
You've seen exactly what I have too. I've been seeing some patients for medical cannabis consultations. I'll start them off on a CBD, CBG tincture with some THC supplementation to cover their pain symptoms, and they'll come back a year later and say, "Doc, I lost 35 pounds, I'm off my metformin." As we see, the leveraging of the entourage effect affects the endocannabinoid system. That's a homeostatic mechanism, and you can treat more than what you even think you're treating, starting patients off on that. It is a wonderful medication. How it helps so many different conditions.
Absolutely.
Dragging lots of different dispensaries around the state, certainly, that people can go and visit. All of them have a different flavor and different character. Why should people make the trip to see you over here in Hot Springs at Green Springs Medical?
So, we're have always been patient friendly, and we actually have product down to $2.50 a gram, which amounts to about $9 an eighth, and that is undeniably the lowest price in the state. We believe in volume instead of just making so much money on one person. We believe in making volume sales, so that's where we make it. But that's the reason you need to come. We've got products that you can afford, and bring a friend or two that have a card, have them pay your gas. Come to Hot Springs. Hot Springs is beautiful. You get an experience that you don't get everywhere else, which is the deli style. You get to look at the product, you get to smell it, use your own nose to tell you which strain you want. You can even pick the buds that you want. If you're into that. But it's just a different approach. It's not the sterile environment that you see in some of the other dispensaries where you look at a piece of paper and you try to order. I mean, what are you going to order? You don't know. We've been here for 4 years. We've probably got the most knowledge of anybody in the state from dispensaries on the products and how to help the patients, and that's what we want to do. We want to help the patients.
So for personalized service, a wide selection at the best prices, according to this man right here, be sure to check out Green Springs Medical in Hot Springs, Arkansas. What's your address here, Dragon?
309 Seneca Street.
And your web page?
It's greenspringsmedical.com, and the phone number is 501-207-0420.
Dragon's going to make sure that you get well taken care of here, and he wants you back as a repeat customer. I think you're going to enjoy your experience. For more information on all things medical cannabis, be sure to check us out at CannabisExpertMD.com. We're also available on YouTube, Instagram, Facebook, Twitter, Relevant, and Gab under Cannabis Expert MD.